And here we go. All right, welcome everyone to the PFCC Partners Workshop. I am Lindsay Galley. I'm the Director of Education for PFCC Partners, and I am thrilled to bring our presenters here to all of you today. We have a really great program being presented from the University of Miami Family Navigator program. Our presenters, who I will introduce in just a few minutes, will be sharing a successful model for linking individuals with disabilities to their needed services. And I had the pleasure of having a check-in with them and learned a little bit about their program. And it's really fantastic and really doing a lot for their communities. So really excited to bring it to all of you. As we get started, if you would like, please introduce yourself in the chat box. Throughout our session today, as the presenters are sharing information, if any questions come up, please put those in the chat. That is going to be the place to go for all questions. We have plenty of time for a Q&A at the end of our session today. So yeah, please put everything in the chat box and we will get to that at the end of our session. And I do want to thank those who registered and shared some of your questions already. So if we have time, we'll get to some of those questions as well. But please use the chat all throughout our session today. Thank you to those who are already doing that and introducing yourself. Really appreciate it. And before we get started too, I actually wanted to do a really quick poll. I would love to know your role in healthcare. So let me go ahead and launch this. All right. So I added as many options as I could think of. So I believe you can select a few if you represent more than one role. And yes, would love to see any others. Please chat in your role. So we'll leave that open for just a minute. Awesome. So thank you for those chatting in other. We have Quinn QIO, dialysis social worker, quality monitor, patient experience, PFCC coordinator, quality improvement. Awesome. Thanks, everyone. All right, and let me share our results. We got a good amount of participants completing. So we have lots of patients, family caregivers, patient family advisors, family navigators, patient advocates, and it looks like we have a nurse out there as well. So thank you all for completing that. Really appreciate it. It's always good to know who is with us today. All right, so who are we? If you are new to the PFCC Partners monthly workshops, we are a small patient-driven organization. We all serve in the role of patient family advisor, anywhere from our local hospitals to national partnerships. Each one of us utilizes our experiences as patient family advisors to support the partnership of healthcare providers and patients and family caregivers, because we know that the best possible health outcomes happen there. We have quite a large goal to reinvent the healthcare industry so that hospitals, healthcare organizations, and stakeholders continuously partner with empowered patients and families as a resource in the co-design of programs, policies, and quality improvement activities. And we do that by really utilizing what we have learned from our roles as patient family advisors to create patient family centered care structures and cultures that support healthcare organizations, and to also support patients and family caregivers who are moving into the role of patient family advisor and supporting them with skills building and skills exchanging among other patients and families, all to really support the healthcare organizations that we work really closely with. And through that patient family advisor support, we also have the Patient Family Advisor Network. This is an ever-growing network of patients and family caregivers serving in the role of patient family advisor. Our mission for the PFA network is to really create a network of thoughtful and prepared patient family advisors that are grounded in an authentic partnership approach to co-design policies, research, and care delivery. So that is a little bit about us, and I am going to stop sharing and pass it over to Nancy Torres. And while Nancy is bringing up her screen, I would like to take a minute to introduce our presenters. So first, Nancy Torres Burling holds a Bachelor of Science in Psychology and a Master's in Human Resources Management. She is the Family Navigator Program Director at the University of Miami and a family faculty at the Mailman Center for Child Development. She became involved in the disability field after her son was born with developmental delays, and she has participated in several boards and coalitions, including Parent to Parent of Miami, Florida Network on Disabilities, and Florida Family Leadership Network. We are also joined by Paulina Wolfe, Family Navigator and Lend Family Leader at the University of Miami and the Mailman Center. She completed her bachelor's in business administration at EAFIT University prior to moving to the United States, where she obtained an associate degree in pre-law at Miami-Dade College. She's originally from Colombia and the mother of 2 boys who are under the spectrum of autism, and she is always seeking for tools and pathways to make people's lives better in their community. And finally, we have Carla Mejia. I knew I was going to mess that up. Mejia, who graduated from Florida International University with a bachelor's and a master's degree in social work. Mrs. Mejia has more than 10 years of experience working in social services, including vocational training, counseling, mental health, rehabilitation, and placing people with disabilities in competitive employment. Beyond joining the Family Navigator program at the University of Miami, Mrs. Mejia worked for the Miami-Dade Community Action Agency, the Lighthouse for the Blind, Goodwill Industries, and United Cerebral Palsy, or UCP. As a family navigator, Mrs. Mejia addresses families' concerns, including but not limited to evaluation, intervention, therapy providers, health insurances, school, recreational activities, and so much more. So I am thrilled to welcome, I think Nancy is going to kick us off first.
Thank you, Lindsay, for inviting us and allowing to share information about this wonderful and efficient program that is called the Family Navigator program. I'm going to start, and then Paulina and Carla also will join the conversation, and we hope that you find it interesting and inspiring to continue improving the services that we provide to our families living with disabilities and chronic medical conditions. So let's start with the titles, right? This is the Family Navigator program that belongs to the University of Miami at a specific area of building that is called the Mailman Center for Child Development. We are, let me expand this one moment. We are located in the South Florida area, Miami, South Florida area. We cover around 4 or 5 different counties. And here is the map of the physical location where our building is this one that is here with the blue arrow, the Mailman Center for Child Development. As you can see, we are located in a huge medical campus in the downtown area of Miami, where you find the University of Miami Health System, the Jackson Health System, the 2 very big providers, and also the Miller School of Medicine. So in this big area, you can find plenty of medical intervention and different kind of programs catering families living with disabilities and other conditions. So this is important to understand because this clinical setting is part of the definition of our program. This is the team. We have been growing little by little. Most of the people that is mentioned here, they have a small percentage of time that they dedicate to our program. And being Carla, Paulina, and myself, the ones that are a full dedicating to the development of the services that we provide. You also can see the names of 2 medical students that they are studying medicine and also public health, and they have a very important role in the developing of our process and our model, and we are going to mention that. But this is an example of the multidisciplinary team that participates in the program. So what do we do? Something very important is that we are funded by the TAF Foundation. Their headquarters are located in New York, and they found different disability initiatives around the country. And the main goal of our program is to offer free support, connection, and guidance to families of living with disabilities, special needs, mental health conditions, anything can be under this big umbrella, and connect them then with the right services available, of course, within the University of Miami, but also in the community where the family lives. So we are like a bridge between the families and the different resources available in the community. And we are talking, of course, about federal, state, and local resources. The ultimate goal of our program is to help families to navigate the complex healthcare system. As you know, they don't communicate so well between each other as we would like to expect, in order to increase and support health equity. We have 2 implementation modalities. We were funded in 2016, and for the first, I will say 2.5 years, we focused just on the first one, that is providing direct services to families at the University of Miami. Like we mentioned before, that we are located in a clinical setting. 80% of our families come refer within UM, and 20% come refer through our different partners in the community, and Paulina is going to expand a little bit more that part of information. But very soon, we realized that our capacity was limited, and we wanted to reach out more families. Just to give you an idea, our contract with our funders established that we should serve at least 30 families per month. The reality, of course, is that as an average, we are serving around 50 families per month. But like I said, we have a certain capacity, and we wonder what we could do to increase the outreach. And we came with a solution to develop a training about disability services for community agencies. So we wanted to build capacity in those community agencies that are in need of that. The main objectives of this community training is promote a balanced disability perspective, where the principles of the social model are implemented, increase knowledge, and share our experience and our knowledge that we have about how to navigate disability services in the South Florida community. As you can imagine, the area where you live, the expertise that you have in the area where you live, make you powerful to serve the families living in that area. It's not the same that, you know, if a family calls us living in New York, of course, our capacity to support that family will be really, really limited, because knowing what is available in the community and building those partnerships in that community is a key component of the success for this program and this model. So talking about the key components, we have identified these four. For sure, maybe we can mention more, but let's focus on these ones. One, of course, as I mentioned in the beginning, is the interdisciplinary approach that we follow, because we have participants, employees, and volunteers from different perspectives and disciplines. We have family members, as Lindsay mentioned, in my experience, Paulina being family leaders. We have a professional perspective, Carla being a social worker. We have an advisory committee, and we have one member of our advisory committee attending this presentation, Ms. Linda Starners, that has several roles in the community too. And we have cell advocates, other family representatives, community representatives that also participate in those meetings, physicians, clinicians, interns, because as you can imagine, we work very closely with the Miller School of Medicine, and many of the students and the interns will be involved in one way or another one with the clinics and programs, including our program. The other one is the one that I just mentioned, the community engagement and building partnership with our peers. As I mentioned in the beginning, we are the bridge. So we per se, we provide a limited number of services. The main one, of course, is doing that linkage to what the services, to the different services available in the community. So we need to know who are running these programs, and where they are located, and what are their requirements, so we can support these families. Paulina will explain more about that. This is not only a referral program where we say, call this number. If the family needs to be connected with a specific organization and we know somebody there, we will contact that person, and we will do a warm handoff referral process. And later on, we will follow up not only with the family, but also with the community agency that we connected the family to, so we can know what is happening if the needs of the family have been addressed. Of course, family engagement is vital. And we, of course, as I mentioned, we have family representation very involved in our program. And I will say that that knowledge, that personal experience of navigating the services for your own family is vital, because we really care for our families, and we want to help them to improve the quality of life of their children or their maybe adults, because also we cover the lifespan. And another thing that time has shown us, especially during COVID, is that we have to be ready to change from one moment to another one. Of course, this is always true, but during COVID was more evident. And I want to mention that, of course, at that moment, we needed, as most of you, I imagine, needed to change from one in-person approach to the Zoom approach, which we were able to do it very quickly, thanks to the technical support from the University of Miami. We were using Zoom before COVID, so we were used to it, and we knew how to use it and implement it. But of course, with COVID, it was, not only a small percentage of employees, everybody was using Zoom. And also we have to be aware of what are the changes of the needs of our families. And during COVID, we did a study to identify, we wanted to know if really there was a change, a significant change in the needs of our families, and we were able to identify it. We saw a decrease on clinical connections, intervention connections or intervention needs, and we saw a decrease and an increase on anything related with financial support or financial needs. We are talking about food banks, food stamps, rent and utility payment support, applying to Medicaid because one of the parents had lost their job, eviction support, unemployment benefits. So we see a significant increase of that during the first year of COVID. During the second year, during this year, we saw that the pattern went back to previous COVID, and now we see a more balanced request of needs. What are our outcomes? Well, we have different kind of outcomes defined in our contract. These two are really important. One is the number of families that we serve. And you can see here that since 2016 until November, last month, some days ago, we have served 2,314 clients. Being 2019 the busiest month, the busiest year, but I think 2022 we are going to be at least at the same number or even higher. Also, the other thing that we track is the percentage of connection. And what do we understand for a successful connection? Is, as I mentioned, we do a follow-up process with our families, and in some moments, of course, the case will need to be closed. And one critical moment is when the family let us know that they were connected with at least one of the resources that they mentioned during the assessment process. So that case, we will consider it as a successful connection. And our percentage among these years have been between 69-78%, which is really, really high. When we talk about the outcomes at the community level, for those agencies that we train, that also this training is a 3 months commitment with the agency, where we provide the training, we do coaching sessions, and also we do data collation to see if the training had some kind of impact on the percentage of connection of their families. And with community agencies, the percentage is even higher, has been even higher. Getting an average, when we put the data of all the agencies that we have been working with, getting an average of 83%. When we think why is higher, the main reasons that come to the table is that because these are community agencies that are really embedded in the neighborhood, and they have a more frequent and constant contact with their families, that factor increases the chances, increases the probability to have a higher connection. Also, families tend to trust them more because they belong to the same community where they live. As I mentioned, we are in a clinical setting. That Melbourne Center building it's sometimes when you don't know the area, it's really complicated to get there. So, and even that we do follow-ups, and of course we establish a rapport with our families, the relationship that we have with them is completely different than the relation that they have with their own community agencies. So this is, the training has proven that it works. And it can be, of course, beneficial for the families without generating any extra cost to the community agency that decides to participate in the training, which also is completely free. Another important outcome is our automatized satisfaction survey. The automatization of our survey is relatively new, like maybe 5 months ago. Before, what we used to do was calling families, which really was not the most effective way. Now, every time that a case is closed, the following days, the family is receiving an email with a survey. We have a decent percentage of answer, is around 17–18%. As you know, nobody likes to answer surveys, but at least it's more than what we were getting before when we were doing the calls, because usually we were between 10 and 11% of answers. So we are happy. We need to improve, but so far we are happy with that percentage. So what do we measure in our survey? First, the Family Navigator performance. Families are able to identify who was the Family Navigator who served them, and they will provide information about the quality of the support, the accessibility of the Family Navigator, and the quality of the connection of that Family Navigator provide. Also, we measure the impact of the program. And here, when we did an extensive research about this topic, and these are the three more common points. One is there was an improvement of the family advocacy skills. If it was a reduction of the connection time, if our presence and our support really reduced the time that for the family to be connected with one of the specific resources, and if there was an increase of the family ability to access services. And the last point is, of course, the general satisfaction level. And here I'm going to pass the baton to Paulina.
Thank you, Nancy. Thank you, everyone, for attending today. My name is Paulina Wolfe. I'm a Family Navigator at the Family Navigator program. Our Family Navigator program has been building a solid data collection system throughout the years, and this was created and implemented by our medical students in our team with the support and collaboration with them. And this data collection, as you can see on the slide, it's big, including demographics, family needs, barriers, resources connected to the families, and the follow-up time. The referrals, as Nancy mentioned before, the referrals of our families that we received are mostly from the clinics at the University of Miami, like neurology, psychiatry, genetics, and 20% come from community partners. They can be schools, external agencies, self-referrals, other families, etc. Our process began with an intake where we have a conversation with the family and build a case according to their specific needs. This is a standard format that we use under the guidelines of HIPAA compliance protocol. Then we come up with specific recommendations and options of resources, services, programs available in the community that better fit to the family situation. The follow-up to our families varies depending on the unique circumstances and characteristics of the case. As family navigators, we cover different levels of services and areas of concern. As I already mentioned, we start with a conversation with the family where they have like a safe space to explain the case, what is the situation, what's going on. The basis of our services in the Family Navigator include the educational component and the linkage to services. These vary from family to family depending on the areas of concern. And we can speak about school system, evaluation and intervention, health insurance, whether there is a health insurance or not health insurance at all, the medical coverage, legal and financial aid, which has been predominant in the last year, as Nancy already explained, immigration services, especially for these families that are new to the country, assistive technology, where a device is needed for communication purposes, transition to adulthood, depending on the age or whatever the stage is. So legal representation is needed, post-secondary education options are included, employment and social insertion are also part of this component. Sometimes throughout the conversation with the family, the emotional state comes out and additional circumstances we need to address. So we have to be prepared to listen and to be able to provide care and support. There are other events within the community, like recreational activities or short-term free programs that our families can benefit from. So we also provide that information as well. Some cases where there is a crisis and the family needs immediate intervention because of the nature of the situation, we can refer them to our social worker services. And there they will receive counseling and guidance for a short-term period, depending on the case. And it's usually between 6 to 8 weeks. An example of a family that I'm personally attending, we call it the Green family. So this is a mother and her 2 children recently moved to Florida from New York after a difficult divorce situation. So mother is overwhelmed. The boy is an 8-year-old with a genetic disorder and attention deficit disorder. So her daughter is a 3-year-old with no concerns at all, not yet. But her son is enrolled in a public school, and since they are coming from New York, there is a process of transferring the IP, which are the details for his accommodations and services at school. And the process hasn't been finished yet, so the boy has to be returned to home every single day because he struggles without those accommodations. She's also looking for mental health and counseling because she needs that kind of support right now, like not only for being new to the state, but also for the situation per se that she was going through. In this case, we can see the strength of this family, which is that the mother is really aware of her needs and her children's needs. So now our recommendations addressing this particular situation was, okay, regarding the school issues, there is an agency, which is, and according to the location, because the agencies, the services are provided and offered according to the location of the family. So Family Network on Disabilities is the agency that could help this family for the accommodation and resources for her son. I also mentioned the Florida scholarship options in the case that it was more convenient for her to place her son in a private school. The evaluation, since she was having the history with her son already, Fiddlers was offered as the agency that will help with the process of evaluation and enrollment of children with special needs between 3 and 5 years of age in the public school system in Florida. And Fiddler stands for Florida Diagnostic and Learning Resources System. So they provide that evaluation and then the accommodation or whatever the assessment is to place the child in the best environment according to the area where they live. And also the mental health counseling, I offered the mother, like the support of our family Navigator program social worker, and she was super happy to receive the support. And that's how we address the family. And she's going through all the connections and services we already mentioned. Now I'm going to pass it to Carla, which is another family navigator, and she's going to describe more.
Good afternoon, everybody. Thank you for the invitation. I'm Carla, one of the family navigators, and I'm going to present you a family that I'm currently helping. Let's call it the yellow family. The situation is, this is a mother of two boys, 14 and 12, both diagnosed with autism. This family is facing several challenges: eviction, lack of transportation, health insurance requirements, difficulty finding therapy providers, and school issues. The father is not involved in their lives. The mother lost her job because she was receiving constant calls from her son's school due to the bad behavior. What are the strengths that I have been seeing from the mom? She's very proactive. She likes to cooperate with the services. When I tell her, please, let's do this, go to this place, let's make the phone calls, she says, yes, Carla, let's do it. I want the best for my kids. I want to be better for them. So she's a very dedicated mom to her boys and the help that they need in the treatment. So basically for this family, what is the main concern? Because it's the eviction. Eviction, it's a sad situation that they were facing. If she doesn't resolve the eviction situation, there is no way in her mind that can she go ahead and take care of other things for her and her sons. So eviction, Legal Services of Greater Miami, City of Miami Neighborhood Office, the Advocacy Network on Disabilities, and the Lotus House are a group of agencies, programs in the community here in Miami that are helping this family. Legal Services of Greater Miami, it's helping with the eviction process, asking for an extension, checking the paperwork, everything has been legally done. So they are working with her in that particular aspect. City of Miami Neighborhood Office is a great neighborhood office in her area that takes care of different aspects, such as if she needs to make a phone call, if she needs to send a fax, what if she needs a school supply for her kids, what if she needs food. So they are helping her in that area. The Advocacy Network on Disabilities also help this family by providing a food card to go to her neighborhood supermarket. And the Lotus House is helping the family just in case the eviction process is completed. Hopefully not, because that is going very well. So that's a shelter here in Miami that takes care of women and kids. For the transportation situation, they were able to apply for a bus pass, and they are using that to go to their medical appointments. Health insurance, this family has health insurance, but the only thing that they were facing is the providers were not providing the services. So mom needed to make some phone calls to get connected to a new provider as soon as possible, and they did that. She's also having their boys enroll in the therapy again. For the school issues, Parent to Parent of Miami, it's an agency that helps parents that have a child with special needs in the school system. They were able to get in contact with the school to make the appropriate accommodations, reviewing the IEP process, explaining the mom what to ask for, and guiding the mom through the process. Very important for services is the quality improvement. How we know that the program is working. How can we get better in providing the best services for our families? So these are some feedback that we have received. The help that one received at a moment of feeling lost, that was one of the comments that we got. Erase my fears and concerns. The human aspect, compassion of the program. The effort that she put every time we had difficulties to find the right resource, but she kept looking, helping me to keep going. For example, if we don't find the resource at the minute, at the moment, we continue providing the best services. Okay, maybe that resource didn't work. So we go to the next phase, we go to other resources. Carla's positive attitude met my expectations when looking for the best resources for my son. Paulina, I can't stress enough the value of your support. And like this one, it's very helpful to see this feedback and to hear from our families, because that's the best way for us to get better at it. What are the new needs for the families in your community? Are they needing more supplies for school? Is this family in need of a food stamps application? Are they having some trouble getting to one point to another? So we, the best goal is to erase barriers for these families to get connected. So that's a great component, the surveys, the opinion, and the feedback. So far, what lessons have we learned? All these are important points, like addressing barriers, like I mentioned before. What is happening in the community at the moment? What happens with the family that we're helping? Each case is different. Each case have different needs. Each case is a different stage. Some families already know what's going on with their kids. They know more or less what's the right treatment. Other families are new to the system. Other families are new to the country. Other families are new in finding out that their child has a disability. So we adapt to their family situation, but we also adapt to what's going on in the community. Like when Nancy mentioned, when we were facing the start of the COVID-19, how we did adapt through Zoom meetings, making phone calls, following up. Following up is a good and excellent tool that we use, because we don't just give the phone number to a family, call this place, and hopefully they will help you. No, we guide the family through the process. We tell them, okay, ask for Nancy, ask for Paulina. They will be more than happy to help you. They call, they guide the family through the process, and at different stages as well. The family, maybe they need some information because they are facing some type of school issues. So we guide them through that. But what happens after a couple of months? Maybe that family starts to facing eviction, transportation, or maybe their kid needs a new evaluation. They are more than welcome to give us a call back or calling us directly, and we will be more than happy to help them. So adapting to better serve the families, that's one of the goals. Building partnerships, very important. Our goal is not just to keep this information to ourselves and within the Miami community. Our goal is to expand, like Nancy mentioned before, to talk to other providers in the community, other agencies. We create the partnership. We train them to provide the same services in their particular agencies, because the more people we touch with these services, the better the community will be. So there are many agencies in our community that are taking advantage of this training, how to connect people, kids, adults with disabilities to the right resources. And the data, we collect data because numbers are great. How you prove that your work is being done correctly, how you prove that the families that are supposed to be in help are being helped. So with the data collection, with the numbers, with the disabilities, with the neighborhood, we reach more people every day. And meeting people where they are. Many families, like I mentioned before, they have different stages. Some families, they already know what's going on with their kids. Other families, they just found out that their child has a disability. That is an overwhelming news for these families. Maybe they're new in the country, plus different barriers, transportation, lack of health insurance, a language barrier. They don't know where to go. They don't know that some resources exist. So how they know? They give us a call and we accommodate, we adapt to their necessity, and we understand. We create and we have that compassion that the family is looking for. So understanding the family, transmitting that support that they need along the way, it has been a great success for this type of programs. And we include the family members, like you see there. The family members are very important. How you help a child if the family is not involved. How you help an adult that has a disability if maybe the mom, maybe the grandparents, the neighborhood in where they live is very, very important, because there is no way they can help themselves alone in that particular situation until they get the training, they get the self-advocacy that they are looking for. So that plays an important role in helping the families. And like I mentioned also, expanding our reach, training to partnership in their neighborhood, it has been noticed that many of these organizations that are working in their communities create a better connection, because those are the professionals that they see every day. Maybe they take their child to the daycare, and that daycare knows about resources for a child with disabilities. So they see their faces every day, and that creates a personal connection, a family connection in their particular neighborhood, and that has been very successful so far. And also I wanted to share our contact information later on. So anything that you want to know about it, then it will be great to know. Thank you.
Oops, I stopped before going. to that slide.
Yes, that's the contact information. You can check out, the website is listed there. Also, our program's email and our program director, Nancy Torres, her email, and of course, the phone number to be contacted.
Thank you, Carla and Paulina.
Thank you.
So I'm going to share the same information via chat. So I want to stop sharing so we can open the space for questions and comments.
Yeah, absolutely. Thank you, Nancy, for putting that information in the chat too. That will be really helpful. And thank each and every one of you for the presentation today. I think why I resonated so much with the work that you're doing was that little tile right in the middle that said meeting people where they are. That's what we try to do every day, and you're really kind of living up to that standard. So great work and great presentation. Thank you. It looks like we have a few questions in the chat. So first from Janice, if you could provide additional services, what else would you like to offer?
That's a great question. As I mentioned in the beginning, we are funded by the TAF Foundation. That is a private funded funder located in New York. And we have a contract and certain number of years, every 2-3 years, we have to present a proposal. And next year we have to renew, and we have to do this to see if they decide to renew the funding. So usually that's the time that we use to present our future goals. You know, what is the vision that we have to continue growing the program? So one of the things that we have been thinking for the next years is to expand the training. We are really satisfied regarding the direct services that we provide with our families. And of course, our funders have been very clear that they don't want to invest on hiring more staff, more family navigators. So in that area, we are doing the best with what we can. But regarding the training, the plan is to expand to community agencies in different counties. Currently, during the past years, we have been training agencies in Miami-Dade County, and now we want to move to Broward. That it will be included in our plan. And also we want to continue and expand the awareness process that we have and be present in different state conversations and conference, and if it's possible at national level, to promote this model as an effective approach that other organizations can implement.
Great, that's really helpful. Thanks, Nancy. And I think along those lines, we saw a few questions in the registration about how people can start something like this in their own areas. So I'm curious what advice you would have for those interested in getting a Family Navigator program started.
That's a process.
Yeah.
And I have to say that we are willing to share with more detail, our own experience. I would say that, of course, it's critical to have a vision, to have one organization that has the vision that they want to implement this kind of program within your scope. It could be like a clinical organization, it could be a nonprofit organization, a community agency. It doesn't matter the nature of the organization, but you need a vision. Mm-hmm. And I remember I heard from Dr. Brosco, that is our medical director, that they spent like 2 years developing that vision and another 2 years to find a founder. I think that was also a difficult part. But when they finally got the vision and the founder, it was a matter of finding the right people and the right team. And I was the first person hired. At that moment, I was, I continue, of course, but at that moment, I was very involved family voice, a family leader, participating in as much as I could to learn about the systems and of course about the specific resources for my own son. And well, it was a matter to be in the right time and the right moment. Of course, my professional background helped. My professional background is in the psychology area and also management and project management. So I think, like I say, first vision, then finding the right people. And in that right definition, I will say you need to find people that this is more than a job for them, because as you can imagine, salaries are not, as they should be, as they could be, because basically we are working with a grant. So you need that inner motivation, that passion, people that really want to make a difference in the field, and they don't care if, making a call a family at 7 p.m., right? Because what they want is to help.
Right.
I will say those are the two main components. Three. Vision, funding, and the right team. And then it's a matter of, start working and start creating your own plan, or follow another one, or get one model and see how you can accommodate it to your own reality, because we understand that, of course, each neighborhood, each state is different. And of course, the needs of the families are different. And that's very important when you are to keep in mind when you are developing this model.
Yeah, absolutely. Thanks, Nancy. Those were all really great points. And in talking about building your team too, you obviously have a motivated team. They're doing this for so many reasons outside of the paycheck. I'm curious what's the vetting process? And maybe Paulina or Carla, you can talk about like the process that you went through to become a family navigator. I think it's great too that you can use your own lived experiences as well, and kind of navigating the system. So I'm curious what that process was like to become a family navigator.
Well, my personal experience, it was very similar to Nancy's, because I'm a mother of 2 boys under the spectrum of autism. And I started the world of therapies and healthcare providers since they were 2 and 3. Now they are 14 and 13. So it's been a whole life as a mother and as a learner. And I'm also part of, I'm a family leader. So I've been training myself and I have a business professional background, but the life just took me to this pathway. So I've been like building it up with other credentials and knowledge and experiences. And I just ran into one of the rotations of the clinics was the Family Navigator program, where I was doing my hours for Len. So then I stick to the program, and I'm super happy just sharing what I've already learned and practicing more of the things that I'm, learning throughout the way.
Right. Absolutely. Thanks, Paulina.
In my case, started when I was going to college, school, doing volunteer services, hours with family, with the community. And then I got some type of, that I like it. I said, okay, I like this, helping my community, helping other people. So from one point to another, school, the volunteer, working for the Miami Lighthouse for the Blind, working with people with disabilities at Goodwill. So from one point to another, started to take me there. And one of my goals was to help the entire family with the kids. So then I had the opportunity to find out more about the University of Miami. The program, I really liked it because it's a broad program that has many opportunities to guide the families through every process along the way. So that was my my motivation, and what continues to be done. I see the results. When you see the results, you feel more motivated to continue making a change in the community and with these families that really need the guidance and the education to go to the next step.
Yeah,
Yes, we have two different hiring process with Paulina and Carla, and what it shows us is that you have to be flexible, right? With Carla, we have a more classical hiring process where you publish your the position and you do marketing through the University of Miami, of course, and we do all the formal interviews and everything, and she was the one who was selected. With Paulina was different because, as she mentioned, she is a family lane trainee. Lane is a specific program that is called Leadership Education in Neurodevelopmental Disability that belongs to the AUCD, that is the Association of University Centers on Disabilities. This is one of the different organizations and structures where the University of Miami belonged to. So she was a family trainee with the Family Navigator program. So she came to learn. So she did different things. She observed until finally she was doing like an internship as a Family Navigator. And then once again, fate came and we had a position open and we offered to her, and the rest is history.
Nice.
So there are different ways to recruit your team.
Right. Absolutely. I love when fate kind of puts something like that you're already so passionate about, in your hands and you just kind of go with it. That's really exciting. I think we have time for one more question, and we got a lot of questions about the partnerships that you're able to create with maybe other hospitals, obviously the community organizations with all of those resources that you had shared. So what does that partnership look like, or how are you able to partner effectively with other organizations to provide resources to the families?
In a very old-fashioned way, human contact.
Nice.
That's the way. Of course, being in the area, Carla as a social worker and Paulina and I as users and clients of many of these services, we knew people, right? We knew who is running X organization, who is the person to contact in another organization, and we bring our contact list, our cell phone directory. We bring it to the table and then start reconnecting with these people and saying, well, now I'm working in this professional role and this is what we do, so let's work together. And we don't know somebody, we knock at the door or try to find somebody else that know that a specific person in that organization, and we ask the favor to do the connection. So it's always looking about what is happening. We attend a lot of community coalitions, right? In different levels, state level, federal and local one. So we spend a lot of time in Zoom meetings, gathering with other people, with other representatives, and keeping the eye saying, okay, this organization may provide services to the needs of our family. Let's contact that person and organize a conversation where they explain to us what kind of services they have, and we explain to them what we do, and we start exploring if there is a room, a space to grow up that partnership. Of course, there are some conversations that stay there, right? You just had a Zoom meeting and nothing happens later. But there are other ones that start growing little by little, and you have a good sense of trust between agencies, and that's what we use as a platform to provide the services to our families. But this is a constant work because as you know, there is a high personal rotation in this organization. So you may have one person in one, and 2 months later, that person is not there anymore. She moved to another state. So you need to start from zero. So this is a constant process.
Absolutely.
But we love it.
Yeah.
We love it.
Relationship and trust building, the old-fashioned way. I love it
Community
too.
engagement.
Absolutely. Yeah, at the core. Absolutely. Well, we are right at time. So I just want to thank you, Carla, Paulina, and Nancy again. I really appreciate this presentation. We have recorded it, so we'll share it out to those who weren't able to make it today. And we can also share out any other resources or information that you would like to pass along to the participants as well. And thanks, Nancy, for putting that information in the chat. So thank you again, and thank you everyone for participating and sticking around the whole time. Really appreciate it. Please let us know if you have any other questions, and have a great rest of your Friday. Thanks all.
Thank you, Lindsay. Happy weekend.
Thank
Yes,
you.
have a good weekend. Bye, everybody.